Here is a number that I need you to sit with for a moments before this video goes any further. Your kidneys filter your entire blood supply every drop roughly 30 times a day. That is not an estimate. That is biology. And right now, while you are watching this, there is a very real chance they are doing that job with less capacity than they had 5 years ago. And you have absolutely no way of knowing it. Not because you are careless, not because you are making obvious mistakes, but because of the kidneys. The disease does not send you a signal until it has already taken something it will never give back. What I want to show you today is what happens in the first 45 minutes of your morning, and specifically what you are drinking or not drinking that is either protecting that capacity or quietly eroding it one morning at UTIs. There are 4 drinks. They cost almost nothing. They requires no prescription. And the one that stops my patients cold every time is number 3. We'll get there. But first, you need to understand what is actually happening inside your kidneys and why the morning, above any other time of day, is when they are most vulnerable and most responsive to what you give them. My name is Dr. Sonam Bodke. I am a board-certified nephrologist with 12 years of clinical experience. I have treated patients at every stages of kidney disease from the early street invisible signs of damage all the way through end-stage renal failure requiring dialysis. And in 12 years the single most consistent thing I have seen is this. The patients who protect their kidneys best are not always the ones on the best medications or the strict test diets. They are the ones who understand what happens in the body every single morning and who uses that knowledge deliberately. That is what this video is about. Not fear, not alarm, practical science-backed information that your 7-minute clinic appointment almost never has time to cover. To understand why these 4 drinks work, you need to understand what your kidneys go through every single night while you sleep. Your body goes 7 to 8 hours without fluid. Your kidneys do not rest during that time. They continue filtering your blood, removing waste products, balancing electrolytes and regulating your blood pressure all night without a sip of a single water coming in to support them. The result is predictable. By the time you open your eyes in the morning, your blood is at its thickest. The concentration of metabolic waste, creatinine, urea, uric acid, is at its highest point for the entire day. Your urine, if you check it first thing, is its darkest shade of yellow. That darkness is not amine or detail. It is a direct visual signal that your kidneys have been working without ads, equating fluids, concentrating everything they process just to get through the night. Now here is where age changes the equation significantly. After 60, the kidneys lose approximately 1% of their filtering capacity per year. The nephrons, the microscopic filtering units inside each kidneys, of which you have roughly 1 million per year, kidneys began to decline in numbers. The blood vessels supplying each nephron stiffened with age. The tubules do the fine filtration work, become less efficient. This is not disease. This is normal aging biology, but it means the margin for error is narrower than it was at 40. A 2019 analysis published in the Journal of the American the Society of Nephrology confirmed that by age 70, the average adult has already lost 20 to 25% of peak kidney function silently, without a single symptoms. When you add chronic, mild dehydration to kidneys that are already operating with reduced capacity, the result is accelerated filtration decline, thicker blood flowing through already stiffened vessels, concentrated waste grinding through tubular walls that are less resilient than they once were, microcrystals forming in an environment that lacks the fluid volume to flush them out before they cause damage. This is the morning stress window, and it is the window these 4 drinks are specifically designed to close. I want to tell you about a patient I will call Margaret. Margaret was 71. Retired school teacher, sharp, disciplined, the kind of person who tracked her steps and read every label on every food she bought. She had been managing mild hypertension with medication for years, and her primary care doctor Conside read her Amidel patient. I want to tell you about a patient who will calling Margaret. Margaret was 71, retired of school, teacher, sharp, disciplined, the kind of person who tracked her steps and read every label on every food she bought. She had been managing mild hypertension with medication for years, and her primary care doctor Conside read her Amidel patient. She came to me after a routine blood panel showed an elevated creatinine level 1.4 milligrams per deciliter, not dramatically high, the kind of numbers that gets a UTIs referrals, not an emergency call, but when around her full kidney function worked up her EGFR, the estimated glomerular filtration rate, which measures how efficient your kidneys are actually filtering blood, had fallen to 48. Stage 3 chronic kidney disease. She had no symptoms. None. I ask her the same question every new patient. Walk me through what you drink from the moment you wake up until noon. Margaret's answer: 1 large glass of orange juice first thing, then 2 cups of coffee, then usually nothing until lunch. On most days she drank fewer than 4 glasses of fluid total before dinner. She was beginning every day with a high sugar drink that spiked her blood glucose and raised the osmosis law. The potency of her urine, followed by that antidiuretic, extended her overnight dehydration rather than reversing it, followed by hours of near zero fluid intake. Her kidneys were starting every single morning behind, stressed, undersupplied, filtering blood that was thicker than it needed to be, with no citrate protection, no antioxidant support, and no bacterial defense for her urinary tract. We restructured her mornings completely. 4 specific drinks in a specific order before the coffee, before anything else. At her 6-month follow-up, her EGFR had climbed from 48 to 57. Her creatinine had normalized. Her urologist, we had confirmed her stone risk profile improved measurably. She told me, I spent for years doing everything my doctor told me and nobody ever. Before I walk you through all 4 drinks, I want to ask you something. What is the very first things you put in your body every morning? Not what you plan to drink, what you actually drink every day before you leave the kitchen. Tell me in the comments below. I read every single one, and the patterns I see there directly shape what I cover in future videos. Your answer matters more than you think. Drink 1. Warm water with fresh lemon juice. The first drink is warm lemon water, and the reason it is first has everything to do with a molecule called citrate. Most people think of lemon water as wellness trend, something people do because it sounds healthy. The science behind it is considered ably more specific than that. Lemon juice is the single richest natural dietary sources of citrate among all commonly consumed fruits, and inside your kidney tubules, citrate does something that nothing else replicates. Your urine in the morning contains high concentrations of calcium and oxalate to compounds that, when left in a concentrated, acidic environment, begin to cluster, first into microcrystals, then into stones. Evening, before they reach stone size, those microcrystals are abrading the inner walls of your tubules with every filtration cycle. The inflammation that caused microscopic accumulates into scar tissue over years. Citrate binds directly to calcium in your urine. It interrupts the clustering process before it begins. It is a natural crystal inhibitor, and it works most powerful when urine is most concentrated, which is precisely in the morning. A clinical trial published in the Journal of Urology found that daily lemon juice supplementation raised urinary citrate levels by more than 140 milliequivalents per day in patients with low baseline citrate, enough to measurably reduces stone formation risk. The National Kidney Foundation includes lemon water in its formal dietary recommendations for stone-prone individuals. How to prepare it. Squeeze the juice of half a fresh lemon, not bottled lemon juice, which is heat processed, and significantly lower in citrate, into a glass of warm water, not cold, not boiling. Warm water reaches your system faster. Drink it before your coffee, before your food, before anything else. Every morning. Do not add sugar. Sugar raises blood glucose, which increases the concentration of harmful compounds in your urine and directly counteracts the protective effect of the citrate. Plain, warm, first. Drink 2. Plain water. Timing is everything. The second drinking is water. And I know what you are thinking. Born with me. Because the reason I am including it here is not that water is revolutionary. It is that almost everyone I see drinks it wrong. Most adults drink water reactively when they are thirsty. After 60, the thirst mechanism becomes measurably less sensitive. Research published in the European Journal of Clinical Nutrition confirmed that older adults consistently underestimate their fluid deficit and reaching the thirst threshold later than younger adults, often only after mild dehydration has already began. Here is what it equates morning water intake actually does to your kidneys. At the cellular level, when you drink a full glasses of water within 20 minutes of waking, blood viscosity begins to drop. Within 15 minutes, by 30 minutes, urine concentration starts to normalize. The filtration pressure on your glomeruli, the delicate capillary clusters that do the primary filtering works, decreases measurably. Your kidneys shift from conservation mode to clearance mode. A cohort studies in the Clinical Journal of the American Society of Nephrology followed over 2,000 adults over a 5-year period and found that those who maintained consistent daily water intake of 2 to 3 liters were significantly less likely to experience a meaningful decline in EGFR compared to low intake peers. The morning window is when this matters most, because it is when concentration is highest and the need for dilution is most urgent. Immediately after your lemon water, drink a full 8-ounce glasses of plain water, not sipped over an hour. Drunk. This is not hydration theater. It is a direct intervention in the window of your stressed filtration entire day. Your measure of success. Within 2 to 3 weeks of consistent morning hydration, your first morning urine should transition from dark amber to pale straw. That color shift is yours. Kidneys telling you they have enough fluid to do. Drink 3. Unsweetened brewed green tea. This is the one that surprise people, not because green tea is obscure. Most people have heard it is healthy in some general way. The surprise is how specifically it works on kidney tissue at the molecular level in ways that no other common beverage replicates. Green tea contains a family of antioxidants called catechins. The most studied and potent among them is a compound called EGPIGL-catechin 3 gallate. This molecule does 2 things inside your kidneys that directly address the 2 primary mechanisms of age-related kidney decline. First, EG has been shown in multiple laboratories and clinical studies to inhibit the nucleation process, the initial step where calcium oxalates crystals begin to form in kidney tubules. It does this at the molecular level, interfering with the crystallization cascade before microcrystals can form. A study published in Urological Research confirmed that EG significantly reduced crystal adhesion to kidney tubule cells walls in controlled conditions, and it is that adhesion, not just crystal formation, that causes the scarring and inflammation that drives permanent filtration loss. Second, chronic low-grade inflammation is one of the primary drivers of decline in kidney function. Older adults, elevated inflammatory markers, CARP and TERLA UK and 6-TNF-alpha core Latina strong, lie with accelerating EGFR decline. EG is one of the most potent anti-inflammatory compounds found in any commonly consumed food or beverage. 2022 Mendelian randomization study are searching, designed that controls for confounding variables more rigorously than standard observational studies found a direct causal association between regular tea consumption and better long-term kidney function comes out. This is the third drink, not the first, because the lemon water and plain water prime the system first. Citrate protection and hydration comes before antioxidant support. Sequence matters. Critical preparation details. You must brew green tea from actual loose leaves or whole leaf bags in water at approximately 80 degrees Celsius, not boiling. Boiling water degrades egg by up to 30%. Pre-bottled green tea drinks are almost universally processed at high heat, stripped of most catechin content, and filled with added sugar. They are not green tea. For these purposes, they are water with a sugar label. 1 cup per day. That is the dose thing. Research supports 2 is acceptable. More than 2 in older adults with any degree of kidney compromise introduces unnecessary caffeine loads and offers no additional benefits. The fourth drink carries a well-known reputation for urinary tract health, but almost everyone who uses it either understands the mechanism or consumes it in entirely the wrong form. Let me explain what it actually does. Cranberries contain compounds called proanthocyanidins, specifically a structural variant called type A proanthocyan. Idins that is unique to cranberries and not found in meaningful concentrations in any other common food. These compounds do something structurally unusual. They do not kill bacteria. They coat the inner walls of the urinary tract with a surfaces that is molecularly resistant to bacteria. Adhesion. The primary bacteria responsible for urinary tract infections, Escherichia coli, initiates infection by attaching fimbriae, tiny hair-like projections, to the epithelial cells lining the urinary tract. Type A proanthocyanidins block that attachment, not by destroying the bacteria, by making the surface too slippery to grip. Why does this matter? Specifically for kidney health? Because recurrent urinary tract infections are one of the most under-recognized causes of kidneys scarring in older adults, particularly women because recurrent urinary tract infections are one of the most under-recognized causes of kidneys scarring in older adults, particularly women over 60. Each UTI that travels upstream to the kidney causes a pyelonephritis episode, a kidney infection, and each kidney infection leaves the amount of behind a small scar tissue. Individually, those episodes seem minor. Cumulatively, over years, the scarring is not minor at all. It is a measurable, irreversible reduction in functional kidneys tissue, preventing bacterial adhesion in the lower urinary tract is quite directly preventing kidney scarring upstream. A 2024 systematic review and network meta-analysis in European Urology Focus, analyzing data across 30 randomized trials, confirmed that cranberry products fully meaning reduce susceptible recurrence in UTI populations. The effect was strongest in older women, the demographic with the precise highest UTI risk and the narrowest margin for kidney damage. The preparation is critical. You must use pure unsweetened cranberry juice, not cranberry cocktail, not cranberry blend, not any products with added sugar. These products contain so little actual cranberries and so much sugar that they actively worsen kidney health by raising blood glucose and increasing urinary calcium. Pure unsweetened cranberry juice is intensely tart. That is correct. That is what you want. Dilute 2 ounces in 6 ounces of water. Drink it in the morning, once daily. That 2-ounce dose delivers the proanthocyanid in the concentration research supports without adding excess potassium. One important note: if you have established chronic kidney disease at stage 3 or beyond, please speak with your nephrologist before adding cranberry juice, depending on your specific kidney function and potassium levels. The potassium content may require monitoring. Margaret called my office 6 months after we changed her morning routine, not to book an urgent appointment, to tell me her follow-up blood work had come back and her nephrologist had used the word stabilized for the first time into years. She said, "I have been trying to take care of my health for 30 years. Nobody ever told me the morning was this specific." She was right. And the reason nobody told her is not negligence. It is time. A clinical appointment has 7 minutes. The morning routine, the conversation takes longer than that. This is why I make these videos. You've been given the same. Margaret eventually received the information. Same information Raymond received. The same information it gives every patient who walks into my practice asking why their kidneys are declining, when they are doing everything they were told. What you do with it tomorrow morning is entirely up to you. Here is my question for the comments. Which of these 4 drinks are you already doing? And which one surprised you most today? Those answers directly shape what I cover next. And your experience might be exactly what another viewer needs to hear to finally take action. If this video was useful to you, please share it, not for the numbers, but for the person in your life who is over 60 and has never once thought about what they are drinking in the first half hour of their day. They may not know they need this yet, but you do. Subscribe if you want to continue this conversation. Coming up next, 5 common medications that over-the-counter millions of people take every single day without knowing the damage they are doing to their kidneys. That video may surprise you more than this one. One final note: everything Ihavi shared today is grounded in published research and over decades of clinical practice. But your body, your medications, your kidney function levels, your history, these are specific to you. And you do not know them. Before making any changes to your morning routine,